Hello, today we are talking about what HRT actually does and actually doesn't. I'm Catie, your front porch nurse. And let's see, there we go. All right, so first off, let's just cut through some of this confusion. If you have listened to different conversations about hormone therapy, perimenopause, hormone therapy, HRT, hormone replacement therapy, and thought, I feel like everybody's either pushing this or they are terrified. That is not your imagination. I call hormone therapy like a loud space when people are talking about it because there's just so many strong opinions and so much fear that was really uh, given to us by previous years ago research. And so we want to learn about current research and what the current situation is and what HRT can do and what it really can't do. So you can just make decisions based on your own needs and have some clarity. So, what HRT is. Hormone therapy is about replacing hormones that your body's losing unpredictably. So that's the estrogen, especially, and progesterone. And in perimenopause, it's just very uneven the way that works. Estrogen does not do a steady decline, it spikes and crashes. And that volatility, that variability drives the symptoms that we get. So this is not a cosmetic thing. It has nothing to do with how you look, but it is about how you feel. Again, I wonder if I can move myself. Let's try. What? See? Okay, so estrogen does not decline predictably. And this kind of shows you, oh, so if I'm feeling really bad, I could be having a spike or I could be having a low. I sometimes will say, oh, I'm having a low E day when I feel like things are really a lot physically. What hormone replacement therapy, is partially estrogen, but what HRT can do for us is reduce that symptom intensity by smoothing those hormonal fluctuations. And that supports our sleep, our mood, our quality of life. Yay! Helps protect our bone health and supports our metabolic health. Again, not cosmetic, it's physiological, biological support. But what hormone replacement therapy is not. Hormone replacement therapy does not fix chronic stress. I think we know this, but I think sometimes we just think, oh, if I do anything, it will help me be less stressed. And HRT does not directly do that. It might help a little bit with symptoms, which make you feel less stressed, but it's not exactly the same thing. HRT does not fix other chronic illnesses. So if you're diabetic or if you have high blood pressure, you still need to take care of those things. HRT is not a replacement for strength training. We all need strength training. Yes, I know that that's one of my things that I harp on because it works. It works with not that much time and not that much time input. And if we don't do that, that's how we age a lot quicker. We lose our mobility. We lose, which is, our ability to walk easily, get up and down from chairs easily, walk stairs, just move in general. HRT is not a burnout cure. If you are burned out, you need to take care of yourself. You need support. I know if you're burned out, you will see this and go, I can't change anything. Then go to a therapist, go to a doctor, please get help if you're burned out, because if you don't fix that first, nothing else will help enough to overcome that. And hormones are just supportive. So it's not a magic pill as much as we want it to be. It just supports our own body and mind. Let me just reiterate, hormone replacement therapy does not fix stress or replace our lifestyle habits. And And it's not a magic pill. It's just not. If somebody says to you, this will fix everything, you're going to feel so much better tomorrow, that's a red flag. You want somebody who's going to tell you the whole truth. Like, hey, this might take a little bit to get used to, might take a little bit for your body to get leveled out, but we will figure it out together. Now, who HRT makes the most sense for? HRT is most helpful for women who are earlier in the menopausal transition, earlier in perimenopause. Also, the research says before age 60, who have moderate to severe symptoms. And that makes sense because the worse your symptoms are, the more some support will help. Women who want symptom relief and that long-term protection for their health. And of course, women who have no major contraindications. So this is all about the fit of the person. It has nothing to do with morality, judgment, anything else. This is the calm truth that I want to leave you with. Obviously, hormone replacement therapy is not mandatory. It is up to you. It is a way to support your physiology, your biology, your normal self. It is not a cheat or a way to get around perimenopause. HRT is not dangerous by default. The research has changed so much. We have learned the report that scared the heck out of all of us was from 2003. And now we have a lot more research, luckily, and we know that there are certain times, like earlier in perimenopause, before age 60, that are better for people to start HRT. And we know that the risk is actually lower than was thought in 2003, which makes sense. But HRT isn't any kind of failure either. It's not bypassing the menopausal transition. It's just supporting your own body. So it's a tool. Tools are allowed, just like meditation, just like yoga, just like strength training. It's a tool. Trust your wisdom. Trust yourself. Please talk to your provider, your healthcare provider, if you're interested in hormone replacement therapy, and see what their attitude is. Don't accept an attitude of derision or condescension. Do not accept it. Find a new provider. Follow my email list for more of this kind of content. And thank you so much. See you later.